Imagine you are in a hospital bed. You've just woken up from major back surgery, and that characteristic hospital smell fills your lungs, and then the pain hits you. You ask your doctor to make your pain stop, and he says, here's a Tylenol. I'm Lizzie Kramer, and this may seem dramatic, but this situation is becoming the reality for chronic pain patients as prescription drug monitoring programs, or PDMPs, are implemented across the country. With chronic pain affecting 100 million U.S. adults, according to the Institute of Medicine, it's likely that you know someone who has been or will be affected. Chronic pain, according to WebMD, is pain lasting 3 to 6 months or more and can be caused by a back injury, arthritis, fibromyalgia, or cancer. Even if you are fortunate enough to never have to deal with these issues in your life, it's likely that PDMPs are setting a dangerous precedent for allowing doctors to for allowing the government to intrude on the doctor-patient relationship, which can affect everyone. I have firsthand experience with this situation because my mom is a chronic pain patient. She's had 3 brain surgeries and takes opioids in order to minimize her pain and lead a normal life. I've actually talked to Governor Parson's staff about this issue because Missouri is the only state left without a PDMP. Today, first we're going to look at what a PDMP is and how the harms actually outweigh the benefits. Then we're going to look for a better way to address the opioid crisis. And finally, we will imagine what Missouri looks like with a PDMP and what you can do to take action. Before we dive deeper into this topic, I'd like to clarify a few important terms. First, opioids are a class of drugs that are used as a painkiller, according to the National Institute on Drug Abuse. This can include legal prescription medications like morphine or codeine, and also illegal drugs such as heroin. According to the Office of National Drug Control Policy, a PDMP is a system that aims to reduce prescription opioid abuse by creating a database for doctors to look at that flags certain patients as doctor shoppers. It's kind of like Santa's naughty list. Second, PDMPs aim to identify doctors who are prescribing opioids too often. Now, let's look to what happened when a PDMP is implemented. There's 2 main issues. First, they are ineffective, and second, they use arbitrary guidelines. When Dr. Fink, a professor at Columbia University, conducted an analysis of PDMPs in 17 states, the results showed that there was no significant decrease in opioid overdose deaths in any of the states, and 3 of the states even had an increase in heroin overdoses. Another problem with PDMPs is that they often flag people incorrectly. According to Dr. Klein, a geriatrician, 60% of people flagged as doctor shoppers are actually chronic pain patients. I've talked to the Division of Narcotics Office about this issue, and they openly admit that the system is very flawed. They said that the flags last 6 months in the computer-generated system and cannot be edited out by a live person if they realize there's an error. For chronic pain patients, this means 6 months without any treatment for their pain, which is actually a big reason why states with a PDMP see an increase in illicit drug use. It's when patients are abruptly taken off their medication, they often turn to street drugs to treat their pain. The second problem is that the PDMPs use arbitrary guidelines. They ignore that a pain management doctor is likely to prescribe opioids more often than, say, a family doctor. When Governor Greitens proposed a PDMP in 2017, Missouri doctors spoke out in a Missouri Times article saying that the system often targets doctors who are prescribing opioids correctly. As I said, these PDMPs set a dangerous precedent for allowing a politician to decide your treatment rather than a medical professional. We have now examined the unintended consequences of PDMPs. The only way to prevent this is to not adopt a PDMP. The reality is, very few people actually get addicted from prescription opioids. A study published in the British Medical Journal followed 50,000 people for 8 years after they received opioids for the first time. Only 0.6% of these patients showed any signs of misuse during that time. This is contradicting the narrative that we often hear about opioid addiction. Another study from Dr. Lilly in Missouri shows that the increase in overdoses, often called the opioid crisis, has been primarily due to illicit fentanyl. As you can see on this graph, the blue represents prescription opioids and the red is illicit fentanyl. So the PDMPs focus on targeting the blue and completely ignores the red. A graph from the CDC shows a similar trend for Missouri, with the green representing prescription opioids, while synthetic opioid overdoses have shot up. So if PDMPs don't seem to work, what are we supposed to do about this problem? I completely acknowledge that something needs to be done to take care of this. It's absolutely not acceptable for this many people in Missouri to be dying from overdose every year. But a PDMP is simply not the answer. We need to be focusing on the problem, which is clearly the illicit drug, and people who are already suffering from addiction. Today, we have examined why PDMPs are ineffective and use arbitrary guidelines. So what does a Missouri with a PDMP look like? Imagine a Missouri where people like my mom cannot access the medication they need to lead a normal life. But it could be your mom, or your neighbor, or even you. The reality is this is already starting to happen, and we need to take action to prevent it. Here's what you can do. First, you can start a conversation. Stop the stigma around legal opioid use and recognize the difference between opioid use and abuse. Recognize that for some patients, opioids can be just as necessary as an EpiPen or blood pressure medication. Second, I know it's cliche, but contact your elected officials. Missouri is currently looking at adopting a PDMP, and contacting them and letting them know you're opposed could have a greater impact than you may think. To make this as stress-free as possible for you, I'll be sending you a script as soon as I get done with an email, and you just have to fill in your name and call your official. It'll take no more than 5 minutes. It doesn't take much for you to do your part in preventing the pain of thousands of people across Missouri. Thank you.